Acha, this is a right clavicle. This is the medial two-thirds end, and this is the lateral one-third end. The medial two-thirds is convexed forwards, whereas the lateral one-third is concaved forwards. The medial end has four surfaces: the superior surface, the anterior surface, the posterior surface, and the inferior surface, whereas the lateral end has two surfaces and two borders: the superior surface, the inferior surface, the anterior border, and the posterior border. This is the medial end and is quadrilateral. This is the lateral end and is flattened downwards. The bony markings, the superior surface is smooth, whereas the inferior surface has bony markings. If we start from the medial end, the first bony marking observed is the oval fossa, after which we observe the subclavian groove, and then the conoid tubercle, and after that the trapezoid ridge. If we are to talk about the attachments of the bone, on the inferior surface, on the oval fossa, we have the attachment of the costoclavicular ligament, and on the conoid tubercle and the trapezoid ridge, we have the attachment of the coracoclavicular ligament. And on the subclavian groove, there is the insertion of the subclavius muscle. If we are to talk about the attachment of muscles on the lateral end, on the anterior border of the lateral end, there is the origin of the deltoid muscle, and on the posterior border, there is the insertion of the trapezius muscle. And if we are to talk about the surfaces of the medial end, on the superior surface, we have the origin of the sternocleidomastoid muscle. On the anterior surface, we have the origin of the pectoralis major muscle. And on the posterior surface, we have the origin of the sternohyoid muscle.